Let's discuss face reading, the common cold. It is known in modern Western medicine as acute infection of the upper respiratory tract. The common cold occurs year-round, most commonly in the winter and spring. TCM teaches that evil toxins enter the body through the mouth, nose, and skin, triggering the onset of the common cold. The common cold typically runs a short course from 3 to 7 days, then the patient recovers. The clinical manifestations are primarily stuffy or runny nose, sneezing, chills, fever, headache, and general body aches. Some patients may also show problems with the spleen and stomach, exhibiting symptoms of chest tightness, nausea, vomiting, loss of appetite, and loose stool. Colds are mostly caused by the invasion of wind pathogens, resulting in the functional imbalance of the lungs. Face reading, cold of a wind heat type caused by the invasion of wind heat pathogens through the surface of the human body, exhibit symptoms such as thin, yellow tongue coating with a slimy texture and the tip of the tongue turning slightly red. Cold of a wind cold type, often occurring in the winter or early spring and caused by the invasion of a wind cold pathogens, will have symptoms including a white tongue coating accompanied by a pale complexion, severe chills, headache, and a runny nose or stuffy nose. If the patient's ear look red and feels warm, it may be a sign of influenza. So we have here the illustration. The patient's ears look red and feel warm. Therapeutic methods. When infected with colds, you should strive for a balanced daily routine of work and rest and a proper diet. Open windows for ventilation and avoid getting too cold. Avoid going to public places to reduce the chances of infection. Dietary advice: drink plenty of water, eat foods that are light and easy to digest, and avoid foods that are spicy, pungent, oily, and highly sweet. Exercise regularly to improve your physical condition as a means of preventing the onset of a common cold. Once infected, however, do not exercise vigorously because your immune system is weak at this time and too much exercise will worsen the symptoms. Adequate bed rest is recommended. Emotional adjustment is to maintain a balanced state of mind and avoid mood swings. Do not feel upset because of the cold. A bad mood is not conducive to recovery. Moxibustion. When you have a cold and feel cold in the extremities, cold pain in the shoulders and back, or have general weakness in the body, a mild warm moxibustion treatment at the dash point will improve the symptoms. Use a moxa stick to hit the dashu point for 10 minutes once or twice daily. Hold the burning end of the moxa stick at the the body's immune system and relieving the symptoms of the cold. So we have here the Shui point and the Feng Shi points. Massage. In the early stage of the onset, massaging certain acupoints can improve the symptoms. Pressing the Feng Qi, Tai Yang, Yin Xiang, Da Shi, and Susan Li points will dispel wind and clear cold, strengthens the body's immune system, and and treat a cold. Using the thumb or middle finger, press each acupoint clockwise, first for 2 minutes, then counterclockwise for another 2 minutes. Stop massaging until a soreness or distending pain appears in the acupoint. Do this 3 times every day. Thank you for your attention.
Let's discuss headaches of internal origin as we continue with interviewing. External headaches are due to invasion of wind cold, wind heat, and wind dampness, and they all obviously have an acute onset. The headache from wind cold is characterized by a severe occipital headache and stiffness, and is accompanied by pronounced aversion to cold, fever, sneezing, and a floating type pulse. The headache from wind heat is characterized by a severe pain as if the head were being cracked open, and is accompanied by aversion to cold, fever, sore throat, slight sweating, and a floating rapid pulse. The headache from wind dampness is characterized by a dull headache as if the head were wrapped up, and is accompanied by a feeling of heaviness of the head, aversion to cold, fever, slight sweating, nausea, and a floating slippery pulse. So here we have the different types of headache and their significance. A throbbing headache indicates liver yang rising. A dull headache with feeling of heaviness indicates dampness. Dull headache with feeling of heaviness and dizziness means phlegm. Stabbing, boring headache means blood stasis. Headache with pulling pain means liver wind. Intense frontal headache means stomach heat. Severe dull frontal headache indicates retention of food. Dull headache on vertex means blood deficiency. Mild dull frontal headache means stomach deficiency. Headache with feeling of emptiness of the head means kidney deficiency. Acute headache with occipital stiffness means external wind cold. Acute severe headache means external wind heat. Acute severe dull headache means external dampness. Headaches of recent onset, short duration means external headache. Headache of gradual onset and long duration is internal headache. Headache in daytime is qi or yang deficiency. Headache in the evening is blood or yin deficiency. Headache starting at night is blood stasis. Occipital headache means kidney deficiency or external wind cold. Frontal headache means stomach channel disharmony or stomach channel origin. Headache on the temples and sides of the head means gallbladder channel. Headache behind the eyes is of liver channel disharmony. Headache on the vertex is of liver channel. Headache of the whole head is due to internal wind or kidney deficiency. Headache aggravated by lying down means fullness. Headache ameliorated by lying down means deficiency. Headache better after eating means deficiency. Headache worse after eating means excess. So to summarize, there are two main categories of headache, external and internal. For external headache, could be due to wind heat or wind cold or wind dampness. Internal headache can be full or empty. For the full type of headache, can be due to liver yang rising, liver fire, liver wind, liver qi stagnation, stagnation of cold in the liver channel, dampness, phlegm, wind phlegm, retention of food, blood stasis, and stomach heat. For the empty type, we have qi deficiency, blood deficiency, and kidney deficiency. Thank you for your attention.
Let's discuss acupuncture analgesia, the peripheral mechanism, part 2. Pain fibers. A and C pain fibers relay sensory information from the nociceptors and mechanoreceptors to the first-order dorsal root ganglion and subsequently synapse to the second-order neurons in the dorsal horn of the spinal cord. The sensory information is then transmitted through the anterolateral system, especially the spinothalamic tract, for pain and temperature, and the dorsal column medial lemniscus system for mechanical sensory input. Animal studies showed increased pain threshold in both chronically dorsal cordotomized and control subjects, but unilateral ventral section of the spinal cord resulted in decreased effect in the contralateral side. This suggested that the anterolateral system for pain and temperature sensation plays an important role in the acupuncture pathway. Transmission of pain signals and acupuncture signals both require intact nociceptive afferent receptors. Pan et al. Showed that there was no response to pain in rats with receptor inhibition using capsaicin. Okay, A and C fibers have specifically been implicated as being related to acupoints. Lee et al. Used Ivan's blue intravasation technique to map C fibers on rat hind limbs. The area of extravasation was in the distribution of acupoints and meridians. The authors concluded that acupoints were areas with high innervation, particularly with pain fibers. The range of A-type afferents had been shown to elicit a lower nociceptive response in cut spinal dorsal horn neurons. Specifically, electroacupuncture can stimulate A-beta type afferent alone to produce analgesia. A recent study by Leong et al. Showed increased analgesia with activation of A theta type afferent by acupuncture. C fibers also appear to play a role in acupuncture analgesia. The generation of unmyelinated C fibers using capsaicin showed decreased analgesia when acupuncture was introduced to rats. In cat study, C fibers activity persisted after termination of stimulation at stomach 36. This was corresponded to the clinical sensation of continued acupuncture effect for hours and days after treatment. Acupuncture also uses the descending inhibitory pathway to enhance analgesia. Particularly, electroacupuncture modulates the nucleus magnus of the descending inhibitory pathway to diminish the sensation of painful stimuli. Yu and Wang found the lidocaine injection to the NRM stop the antagonistic effect against analgesia produced by acupuncture. This supported the notion that descending inhibitory pathways function to enhance acupuncture analgesia. Thank you for your attention.
Let's now proceed to the differential diagnosis of headache in Western and Chinese medicine. Let's start with the Western differentiation. In Western differentiation, headache can be first intracranial. For this, we have two types. One is inflammatory, when there is meningitis, and this will present with severe headache, fever, vomiting, neck rigidity, rash, a positive Brudzinski sign, and generalized pain radiating to the neck. Next is the non-inflammatory headache. Here we have the vascular type, usually seen in migraine. Here we have a unilateral or bilateral. There is severe throbbing pain, photophobia, nausea and vomiting, pain around the eye radiating to the side of the head. There is if there is cerebral hemorrhage, there will be intense pain, neck rigidity, vomiting, followed by loss of consciousness. Second type of non-inflammatory headache is when there is a neoplasm or tumor. This will be characterized with worsening headache, vertigo, vomiting, mental impairment, and grasp reflex. The third type is of hypertensive cause. In essential hypertension, there will be high blood pressure, occipital headache, stiffness, giddiness, tinnitus, and irritability. In secondary hypertension, there will be high blood pressure from other factors. Next type is cranial headache. Here we have nasal or sinus disease. There will be pain and muscleness in the face, tenderness over the sinuses, nasal congestion, and other symptoms of sinusitis. Other possible cause of cranial headache is otitis. This presents mostly in small children, and there will be earache and possible ear discharge. Another cause of cranial headache is cranial arteritis. Here we have severe and diffuse headaches seen in elderly, temporal tenderness, disturbed sleep, and general debility. Third type of headache is extracranial. First cause could be due to acute glaucoma. Here there will be severe pain in one eye with vomiting, red eye, and hazy cornea. There will be halos and blurred vision. Second cause could be cervical spondylitis. There will be severe occipital headache and tenderness, limited neck movement, and perhaps creaking and cracking. Other causes could be trigeminal neuralgia, dental conditions, cold stimulus, the so-called ice cream headache, oral conditions which lead to headache or mastoiditis. Now let's go to the Chinese differentiation. We'll start our diagnostic questioning according to first organ interrelationship. We'll look into the lung and the kidney and the liver in the Shang cycle, the liver and the spleen, and the liver and the stomach in the Ko cycle. Next, we go into the location of the headache. If it's vertex, it indicates liver blood deficiency, and you can use DO20 and DO21. If the headache is on the sides, unilateral, or at the temples, this is Shaoyang headache, and we can use gallbladder 8 and the Taiyang acupuncture point. If the headache is behind the eyes, on the forehead, this is Yang headache, and we can use DO23 and GB14. If the headache is on the occiput, it's Taiyang headache, and we can use bladder 10 and DO19. Now let's go into the type of pain. If it is dull, it indicates damp or blood deficiency. If it's heavy muzzleness, it's dampness or phlegm. If the headache is intense, severe, throbbing, it is due to hyperactive liver yang or liver fire. There is also thirst, bitter taste, red tongue, and yellow tongue coating. If the headache is stabbing, boring, very severe, there is stasis of blood. If there is a feeling of emptiness, it means deficiency. If there is pulling and dizziness, it indicates wind. If there is intense forehead pain, it's chi stagnation or retention of food. Now let's go into how headache is ameliorated. If it's relieved by rest with food, and it's relieved in the morning or through lying down, it indicates deficiency. If it's relieved by menstruation or later in the day or with activity, it indicates stagnation. Next, we look into how headaches are aggravated. If it is aggravated in the morning, it indicates chi stagnation. If later in the day, it indicates deficiency or hyperactive liver yang. If it's aggravated by activity and excessive mental work or sexual activity or menstruation, it indicates deficiency. If it is aggravated by wind, it indicates wind. If it is aggravated by damp weather, it indicates dampness. If aggravated by emotions, it indicates chi stagnation. If aggravated by food, it indicates food stagnation. And if it's aggravated by posture, it indicates deficiency or stagnation. And if it's aggravated by lying down, it indicates damp phlegm. Now let's go to the Zhang-Fu patterns. For external headaches of external pattern, There could be wind cold invading the lungs or wind heat invading the lungs. For external excess patterns, we have hyperactivity of liver fire generating wind, stagnation of liver chi, stagnation of cold in the liver channel, spleen deficiency with damp obstruction, stomach phlegm fire, and stomach heat. Headaches of deficiency pattern can be due to liver blood deficiency, kidney qi deficiency, or kidney yang and kidney yin deficiency. Thank you for your attention.
Let's talk about relationships among Zhang viscera. Now the spleen and lung. The relationship of the spleen to the lung mainly centers on the formation of qi and the metabolism of water. Qi formation. The formation of qi, especially thoracic qi, depends mainly upon the cooperation of the spleen and the lung. The fresh air inhaled by the lung and the food essence derived by the spleen combine in the chest, resulting in the formation of thoracic qi. With the help of the lungs' dispersion and depuration, the spleen can perform its transformation and transportation of nutrients to the entire body. On the other hand, the spleen can ensure that the lung works normally by continually delivering food essence upward to the lung. Thus, the spleen is a source for forming qi, and the lung is the key for controlling qi. Deficiency of spleen qi can cause insufficiency of lung qi. Prolonged insufficiency of lung qi can adversely impact qi formation and lead to deficiency of spleen qi. Eventually, there will be deficiency of both spleen qi and lung qi. Clinically, this is manifested as poor appetite, loose feces, emaciation, and debility. Now let's go to water metabolism. The lung has the functions of dispersing and depuration and of regulating the water passages. And these functions assist the spleen's function. The spleen transports fluid and nutritive qi to the lung, which helps the lung in its functions. Cooperation between the lung and the spleen ensures that water metabolism remains in equilibrium. If the spleen fails in its function of transportation and transformation, water and dampness may accumulate. They may then gel into phlegm, which in the lung can cause obstruction. The obstructed lung loses its function of dispersion and depuration and produces such symptoms as tightness in the chest and cough with much sputum. Thus, the spleen is a source of phlegm formation and the lung serves as the container of phlegm. If the lung loses its functions of dispersion and depuration, water and dampness may also accumulate, in this case, blocking the middle jiao. Since the spleen is one of the two main organs in the middle jiao, its functions also become disrupted. The result is edema, lassitude, abdominal distension, and loose feces. In this diagram of the relationship between the spleen and the lung, we see that spleen transports and transforms qi. It also, as it transports to water and promotes water metabolism, and the lung transforms qi and regulates qi. Thus, it disperses and descends. So we see that the qi and the qi goes down and strengthens and equalizes water metabolism. Thank you for your attention. Let's talk about diagnosis according to Zhang Fu organ patterns, the liver qi stagnation and urinary bladder qi stagnation. Liver qi stagnation and urinary bladder qi stagnation, this will usually be a recurrent chronic pattern with acute flare-ups that are triggered by stress and emotional issues, resulting in a stagnation of liver qi. Instead of supporting the functions of the urinary bladder by ensuring the free flow of qi in the body, stagnant liver qi means that there is a general tendency to have qi stagnation in the body as a whole, and it can specifically disrupt the qi mechanism in the urinary bladder, resulting in a disruption of the functioning of the urinary bladder. This is because the liver channel traverses the external genitalia and the urinary bladder. In etiology, liver qi stagnation often arises as a consequence of stress, irritation, emotional frustration, and pent-up emotions. Lack of exercise and physical movement can also be factors. Dietary factors or blood loss can result in liver blood deficiency, which can be the underlying cause of liver qi stagnation. Symptoms and signs: inhibited or difficult urination, incomplete urination, urinary disturbances that are provoked or aggravated by stress or emotional factors, urinary disturbances that are worse or occur in the premenstrual period, tightness, pain or distension in the area above the pubic bone, hypochondriac tension, irregular menstrual cycle, premenstrual tension, cold hands and feet, slight swelling along the edge of the tongue, wiry pulse, especially in the left guan and qi position. Key symptoms would be urinary disturbances that are aggravated by emotional factors or that manifest in the premenstrual period. There will be wiry pulse. Our treatment principle would be to spread liver qi and spread qi in the lower jiao and urinary bladder. So the acupuncture points to choose from would be liver 3, Li4, Ren 6, Sanjiao 6, spleen 6, stomach 28, urinary bladder 18, and urinary bladder 28. Needling technique should be spreading. The explanation is liver 3, Li4, and UB18 spread liver qi. Ren 3 and UB28 spread qi in the urinary bladder. Spleen qi, Sanjiao 6, and stomach 28 circulate qi in the lower jiao. Some relevant advice. When liver qi stagnation is a significant aspect of the imbalance, it is important to address the underlying causes of this pattern. There will often be emotional issues involved in the generation of this pattern. If possible, the patient should try and address these issues. If liver qi stagnation is a consequence of liver blood deficiency, the diet should be adjusted to address this aspect. Physical exercise and movement will help to circulate qi in general. It will be especially beneficial if the exercises focusing on the circulating qi in the lower jiao, hula hoops, sit-ups, and rowing machines can help to do this. Massaging the lower jiao is also recommended. Liver qi stagnation and urinary bladder qi can be caused by the following patterns of imbalance: liver qi stagnation and liver blood deficiency. Liver qi stagnation and urinary bladder qi can result in the following patterns of imbalance: urinary bladder blood stagnation, urinary bladder damp heat, or urinary bladder stones. Thank you for listening.
Let us now go to pathology in Chinese medicine. The topic is relationship between genuine qi and evil qi to pathogenesis. Pathology is the study of the structural and functional abnormalities of the diseased body, from the onset through the course of development to the resolution of the illness. It was first mentioned in the Internal Classic. The plain question states, carefully observe the suitability of the weather. Do not lose sight of the mechanism of the illness. Again, search diligently for the disease mechanism and treat it accordingly. The 19 items on illness pathogenesis in the Internal Classic are precisely a summary of clinical practice. These quotes point to the importance the ancient physicians attached to the study of pathology. In CM, the occurrence and course of development of an illness are closely related to the patient's constitution and the characteristics of the causative evils. When the pathogenic evil attacks the body's genuine qi resists it. The struggle disrupts the normal balance between yin and yang, and this disturbance in turn affects the physiological activities of all the organ and tissue systems of the body. In some cases, the ascent and descent of organ qi become abnormal, and in other cases, the actions of visceral qi and blood become ineffective. In all cases, a variety of abnormal changes ensue, whether in the entire body or in a localized region. The study and application of pathology and the mastery of the many changes in the course of illnesses are of crucial importance for the diagnosis, treatment, and prevention of diseases. In CM, the most characteristic feature in the clinical approach to illness is treatment based on symptom analysis and pattern recognition, which requires not only a systematic symptom analysis and differentiation of the pattern of disease in each individual patient, but also the identification of the cause of the illness and its location in guides, the ascertainment of its course, and abnormal changes. Only then does the physician apply treatment aimed at the root of the illness. This is known as in treatment, seek the root. Pathogenesis. Pathogenesis is that part of pathology concerned with the study of the mechanisms and principles of the occurrence of illness. What is the relationship between the genuine qi and the evil qi to pathogenesis? So genuine qi is the body's capacity for avoiding and resisting illness and recovery, as well as the normal functional activities. Evil qi, used as the opposite of genuine qi, is the general term for all the pathogenic factors that can harm the body, such as the 6 climactic evils, the 7 passions, the pestilential evils, phlegm, blood stasis, and food retention. In CM, the occurrence of any illness is a reflection of the failure of genuine qi to repel evil qi in their struggle. The relative rise and fall of genuine qi and evil qi not only directly affect the occurrence, development, and prognosis of an illness, but also determine the nature of the disease. In a sense, the course of the illness is the course of the rise and fall of genuine qi and evil qi. Now let's look at deficiency of genuine qi as the basis of pathogenesis. In CM, relative insufficiency of genuine qi is the necessary internal condition that permits illness to occur, whereas evil qi is the requirement for illness to develop. If there is sufficient genuine qi, evil qi cannot prevail. Evil qi can succeed only if genuine qi is inadequate. CM greatly emphasizes the body's genuine qi. In general, when the body's visceral organ functions are normal and its qi and blood are ample, then defensive qi is sufficient to protect the body from invasion by exogenous evils or from illness caused by exogenous evils. In such conditions, the body's yin, yang, qi, blood, and the functions of the visceral organs and meridians are all within the parameters of the physiological state. This is known as the genuine is able to repel the evil. Conversely, if the body's genuine qi is insufficient, its capacity for resistance is weakened, and it is unable to repel evil qi. Alternately, if the evil qi is too powerful, it can invade and establish itself in the face of normal genuine qi. In either case, the body's yin, yang, qi, blood, visceral organ, and meridian functions move outside the physiological parameters. This is known as the genuine is unable to defeat the evil. Now let's look at the second part, where evil qi is required to cause disease. Though greatly emphasizing genuine qi and attributing to it the dominant influence in pathogenesis, CM does not neglect the significance of the pathogenic evils. Being the necessary requirement for illness to occur, the pathogenic evil may, under certain conditions, be the key factor. These conditions include, for example, high fever, chemical poisoning, trauma, and bites by animals or insects. In such situations, even though genuine qi may be ample, illness may be unavoidable. Already in ancient literature, for example, the Plain Questions, there are clear statements that pestilential evils are contagious and that prevention of such contagion requires avoidance in addition to maintaining ample genuine qi internally. This is especially true of those more powerful pestilential evils, which can, under certain conditions, cause disease despite ample genuine qi and even bring about epidemics. Thank you so much for your attention. Let us now go to pathology of qi and emotional problems. The topic is blood stasis, heat or fire, dampness or phlegm. Let us look at blood stasis. When qi stagnates, it may in time lead to blood stasis, especially in women. Blood stasis particularly affect the heart, liver, and uterus. Anger and guilt are particularly prone to lead to blood stasis after qi stagnation. However, other emotions such as sadness, grief, and worry may also lead to blood stasis in the chest after a period of qi stagnation. In women in particular, qi stagnation in the breast from sadness and grief may lead to blood stasis and to breast lumps. Next is heat or fire. Qi stagnation may also lead to heat. and most of the emotions can, over a long period of time, give rise to heat or fire. There's a saying in Chinese medicine, the 5 emotions can turn into fire. This is because most of the emotions can cause stagnation of qi, and when qi is compressed in this way, over a period of time, it creates heat, just as the temperature of a gas increases when its pressure is increased. For this reason, when someone has suffered from emotional problems for a long time, there are often signs of heat, which may be in the liver, heart, lungs, or kidneys. And in the case of the kidneys, it's empty heat. This often shows on the tongue, which becomes red or dark red and dry, and usually has a red tip. A red tip of the tongue is a very common sign in practice, which is always a reliable indicator that the patient is subject to some emotional stress. With time, heat may turn into fire, which is more intense, more drying, and affects the mind more. Therefore, emotional stress may, in time, cause fire, and this in turn harasses the mind, causing agitation and anxiety. Now let's look at dampness or phlegm. Finally, the disruption of qi in the qi mechanism caused by the emotions may in time also lead to the formation of phlegm. As a proper movement of qi in the qi mechanism, it is essential to transform, transport, and excrete fluids. Disruption in the movement of qi may result in the formation of dampness or phlegm. Phlegm in turn obstructs the mind's orifices and becomes a further cause of emotional and mental disturbance. So we can see here the summary of the effect of emotions on qi and blood, where emotions cause qi deficiency, and qi deficiency can turn into phlegm and qi stagnation. Emotions can also lead directly to qi stagnation, where then it becomes heat and condenses the fluids and becomes phlegm, and then leads to blood stasis, and where phlegm and blood stasis aggravate each other. Heat also causes fire, and then fire dries up yin. Then yin deficiency leads to empty heat. Here are 5 points to remember. First is, do not interpret the relationship between an organ and an emotion too rigidly. For example, sadness may affect the liver. Next is, do not interpret the relationship between an emotion and its effect on qi too rigidly. For example, fear may make qi ascend. Next is, all emotions affect the heart. The fourth one is, other organs besides the liver suffer from qi stagnation from emotional stress, like the heart and the lungs. The last one is, qi stagnation does not derive only from anger, but may also derive from sadness, grief, worry, pensiveness, guilt, and shame, and in fact from any emotion. Here we can see the summary of the effect of emotions on the body's qi. Number 1 is, emotions disrupt the proper direction of movement of qi. For example, anger makes qi rise and fear makes qi descend. Second is, each emotion affects a given organ. Example, anger affects the liver, fear affects the kidneys. Number 3 is, all emotions affect the heart. Number 4, after disrupting the proper direction of flow of qi, all emotions lead to some qi stagnation. Next is, emotional problems. Qi stagnation affects not only the liver, but other organs too, especially lungs and heart. The last one is, other consequences of the disruption of the qi mechanism from emotional stress are blood stasis, heat, dampness, and phlegm. Thank you so much for your attention.